Hi, this is Silus. Today I will be doing an IV medication using a Piggyback. Primary line is already running. The first thing I will do is implement the standard protocol by checking the doctor's orders and verifying the medication, the dose, the route, the frequency, assess for any appropriate lab values, and also check for any history of patient allergies. All right. The doctor has ordered 500 milligrams of Rocephin to be run in 100 milliliter of normal saline in 1 hour with a drop factor of 10 drops per ml. And after I did my math, I got 17 drops per minute. And since Vancomycin is available in 500 milligrams per milliliter, I will get only 1 milliliter of Vancomycin, and Vancomycin binds to the bacterial cell wall, resulting in cell death. The recommended dose is 500 milligrams every 6 hours, or 1 gram every 12 hours. The adverse reactions are ototoxicity and nephrotoxicity. It is contraindicated with hypersensitivity. The implications are that you can monitor the IV site as it is taxing to the veins, monitor albumin, and do a culture and sensitivity before administering the first dose. Okay, so now I will wash my hands. Using the aseptic technique, I will draw out 1 milliliter of Vancomycin. We'll check the expiration date. Expiration date's good. And then I will clean the bottle. Get 1 milliliter of air injected into my Vancomycin, then draw out 1 milliliter, making sure that there are no bubbles. Alright. Then I would inject my medication to my Piggyback. Inject my medication into my Piggyback. Dispose that needle in the sharps container. And then I would agitate it slowly so that it can mix thoroughly. Then I would place a medication label on the back stating the time, date, my initial, the patient's name, the drug, and the dosage. Then I would get my Piggyback tubing, and I will spike the bag. I would label my tubing with time, date, and initials, and I would prime my drip chamber and my tubing. Okay. Make sure that there is no air. Okay, no air. Alright. Then I would gather all my equipment, go into the patient's room, introduce myself. Hey, Miss Jackson, my name is Silus. I'll be your nurse today. The doctor has ordered a Vancomycin for you. Can you tell me your name and date of birth? Alright, I will verify it with your wristband. Do you have any allergies? No? Okay, then I would wash my hands, put on new gloves. I would assess the IV site for any phlebitis or any infiltration, and ask the patient if they feel any pain, any tenderness. Alright, looks good. Okay, then I would hang my piggyback. Would lower my primary bag. And assuming that the site is already patent, I would clean the port of both the primary and my piggyback. Then I would clean ports. And would connect my piggyback to my primary. Alright. Open it, and then I would establish the flow rate so that it matches the calculated drops per minute, which was 17. So I would let the medication run and check periodically. After it's completed, I would come back, wash my hands again, put on new gloves, and using the aseptic technique, I will disconnect my piggyback, and if we have an alligator clamp available, I would place the alligator clamp on my mini bag for next administration. Then I would go through the completion protocol and assess for any pain. If they have to go to the restroom, ask them if they're comfortable. If they have all their personal belongings with them, and monitor the IV site for redness, any pain, any edemas, and any inflammation or swelling. And I would dispose all my needles and my syringes into the sharps container. Then I would document on my MAR the time, the drug, the dose, and the route, the state of the IV site. If there was any leakage, any redness, any swelling, then I would record the volume of the fluid and also any intake or output.